I hope you're having a great day. Well, today is World Cancer Day, celebrated across the world, and I want to talk about cancer, and I want to talk about all the commonalities that we've picked out from seeing thousands of patients over the years. First, let's talk about cancer and understand, I know this is a sensitive subject. It involves people who have lost loved ones, people who are currently battling cancer and who may lose loved ones, so it comes along with a lot of emotion. There's anger, there's resentment, there's guilt, there's irritability, there's a lot of skepticism, and people are skeptic about what's being said and what's being done. But my whole point is to first start off by telling you that cancer is a multifactorial disease. There are many things that contribute towards the cause of a cancer, and that's why we need to break it down. Number two is, yes, there's a lot of fraud. There are a lot of things that are sold to people in desperation when they have cancer and stuff like that. My whole point today is to make you understand that, number one, what can we do to prevent cancer? Two, is it preventable? Yes, a lot of people ask for science, and there is science. There's a lot of science. We're going to post that science right after this thread, where medical journals and scientific journals are saying that most cancers are preventable with major lifestyle changes. There's about 3 to 5% of cancers which are highly genetic. You may get it irrespective of what you may do. But even then, there's always a little bit of hope. And that's something called epigenetics, which means that your genes are controlled by your environment. External environment and your internal environment, what's happening inside of your system. So certain genes can be turned on and turned off with the right medical treatment and the right lifestyle changes. There are these possibilities. Now, there'll be people who are angry to hear these things because they'll say, no matter what we did, we still lost our loved one and all of that stuff. We're trying to break it down. I feel sorry for all of that stuff, but now we need to break it down and get into resolution mode. Okay? We're not here to say there's a magic drug. There is no magic diet. There is no magic food. There is no magic chemotherapy that is going to take your cancer away. We need to understand it is a breakdown in your immune system. And yes, if you need chemo, you need radiation, you need surgery, you take all of that stuff, and you also change your lifestyle. Just taking chemotherapy and not changing your lifestyle, you're the same body that got the cancer in the first place. The chemo helped you break it down, but you're still the same body and you can get it over and over again unless you've made lifestyle changes. And this scientific article, which we'll post for you to read post this video, tells you major lifestyle changes are required to prevent cancers and help you to put cancers in remission. You know, we're not talking alternative medicine today where people are constantly fighting, Ayurveda's fighting with allopathy's fighting with homeopathy and stuff like that. No, we are talking about integrative medicine. You need chemo, take it. You also need a change in your diet, your emotional health, your sleep hygiene, your exercise, everything, because one thing didn't make you sick. A lot of people blame pollution, contamination in food, contamination in water. Yes, it's multifactorial, but it did not alone cause your cancer, because all of us breathe the same air, all of us should have cancer. All of us eat the same kind of food, we should all have that cancer. But we have a strong immune system that determines who will get the cancer and who will not get the cancer. Now, when we looked at this, I have nothing to sell you, absolutely nothing to sell you. But what I have to share with you is information that has come out from patients, from experiences, from people who are today's survivors. When they had 2 weeks left to live, they were written off, put into palliative care. They are today living their 10th and 15th year cancer-free because they chose to make lifestyle changes. And then there's, of course, something called destiny and what God has planned for you. There are little miracles, there are large miracles. And that's why we can have so much of hope and faith that we fall in that category where the most drastic cancer may be able to go into remission. Okay? So we call that beyond medicine. What is it that you can do? First, let me start talking about the commonalities that we've seen in almost every single cancer patient that we have. Now, when I say and mention these commonalities, it doesn't mean if you have it, you're going to get cancer. I'm not here to infuse fear in you. I'm here to say that if you have it, you better start doing something about it, because when I finish explaining this to you, you will be able to draw a simple correlation made with common sense about why these commonalities can contribute towards the onset of a possible cancer at some point in your life. Number one, chronic constipation. Okay, chronic constipation, half the country is possibly living with that. They think it's okay to live with that because you just get a pill, you get a laxative, and you think that your problem is solved. Think about it, okay? When you poop in the morning, will you put your hand in the pot and take out your poop and play with it and smell it and do all of that stuff? You want. Why? It's disgusting. Number two, it is toxic. Number three, you just don't want to do it because it's something called waste. Imagine that accumulated in your system because you're constipated. That waste will break down into acids, into gases, and these toxins can squeeze across your system into your blood, creating toxicity, which is the number one cause of inflammation and cancers. Cancer is an inflammatory condition. So when you have chronic constipation, it just doesn't mean you have an issue with passing a stool. You have an issue of excess estrogen in your body. You have an issue of extra toxins in your body. You have the possibility of creating an autoimmune condition in your system. It is not okay. You have 5 exits in your body, and if you have a problem with one of these exits, you will have a problem at some point in your life related to disease. These 5 exits are eliminatory organs that work for you to keep you healthy, to keep your immune system strong. Your lungs, oxygen intake, carbon dioxide, okay, we pass that out of our system. Try keeping dioxide inside of your system for a while. What happens? You die. It's as simple as that. So your lungs have to be working the right way. Your liver, your kidney, your skin, and your colon, which means passing a stool. These are the 5 eliminatory organs in the body. And if you have a problem with even one of them, you want to fix it immediately so that your body's own intelligence and immune system can look after you. So chronic constipation is one of the commonalities that we see. The second is chronic acidity. Okay, I spoke about this in my video a couple of days ago. It is not okay living with acidity. You can pop all the antacids that you want so that you get relief and you can continue with your poor lifestyle. Okay, but you are creating an acidic medium in your system, and an acidic ground is exactly the kind of ground that favors the growth of cancer cells. Okay, no amount of popping alkaline water and all of that stuff is going to help you. You need to make lifestyle changes so that you no longer get acidic. So you can treat your symptoms, and that is suppressing your symptoms, and you can still fall sick. Address the root causes. Constipation, chronic acidity. These are 2 commonalities that we've seen. The third, sleep deprivation. I can go on and on about sleep deprivation, the simple science. Okay, when it comes to women, sleep deprivation suppresses melatonin. Melatonin increases estrogen in your body. Some of the most common cancers that we have are ER positive, estrogen strong breast cancers, ovarian cancers, endometrial cancers, prostate cancers in men. We need to understand that we're creating a feeding mechanism in your body. Sleep deprivation reduces your immune system by 70%, which means you can be the fittest person, the best looking person with the best body. But if you have a low immune system because you are sleep deprived, you can still get cancer or any disease out there. So we need to stop fooling ourselves about the importance of sleep. There is enough of medical and scientific data out there showing you the correlation between sleep deprivation and cancer, melatonin suppression and cancer. So that's that we've seen. Sleep deprivation. The fourth is a sedentary lifestyle. In fact, in the pharmaceutical article and the scientific article that we're going to post this call in regards to cancer can be prevented by making major lifestyle changes. That is the name of the article and paper that we're going to share with you. Sedentary lifestyles have everything to do with your cancers, with your immunity. Let's be more specific. Okay, if you are sedentary, you have a weak immune system. You don't have the right amount of blood circulation happening. You can eat organic food, you can meditate and chant all through the day. But if you are not active and you have a sedentary lifestyle, it does not work for you. A sedentary lifestyle has every correlation with obesity. And yes, obesity has every correlation again with the possibilities and putting you in the risk category of most cancers. We need to understand that a man and a woman carrying a lot of abdominal fat, it is not healthy, and you should try your best to cut down your fat percentage. I'm not saying you got to look like a model. I'm not saying you got to get a flat stomach or a 6-pack. But carrying unhealthy body fat in excess is not good for you. Okay, it means more estrogen in your body. You're creating feeding cycles. It talks about metabolic syndromes and everything else. So slowly and steadily work towards reducing your fat percentage. You can still be pleasantly plump, but your fat percentage should come down. So sedentary lifestyle was our fourth commonality. And fifth is emotional distress. Now, a little bit of stress here and there. Sometimes we have the death of someone, or we go through emotional stresses, ups and downs. That's fine. You're not going to get cancer. You're not going to get sick. The issue is chronic, deeply rooted emotional problems. We see this in cases where people have gone through ugly and bitter divorces, or property matters, or in-law matters, or whatever it is that creates chronic stress. You wake up in an environment of chronic stress. You go to sleep in an environment of chronic stress. So just think about it. Your cortisol, which is your stress hormone, is elevated throughout the day. Your estrogen is high, your progesterone is low, your entire hormonal balance is out of whack because your body is constantly in a state of stress, high cortisol, high inflammation, diabetes, cancer, cardiovascular, obesity, everything. So we need to understand that we can keep chasing complication, but if we've not prepared the environment of our own bodies to prevent these things from happening, no amount of complication can fix your problem. So I'll repeat that again. We have chronic constipation, we have chronic acidity, we have sleep deprivation, we have emotional distress, and we have a sedentary lifestyle. These are 5 commonalities. Now, over and above that, of course, if you're eating too many foods with pesticides, you're breathing too much of pesticides, you need to build your immune system. But please understand the importance of identifying what is going wrong with the Okay, everyone's just reacting and getting emotional about cancer. Look at the statistics. The numbers don't lie. Go back 20 to 30 years, okay, where lifestyles were way more organized and healthier than what we have today. Cancer was at its least. And today, we have, despite the amount of technology, awareness on foods, the availability of superfoods and medical treatments and doctors and hospitals and gyms, why are the numbers of cancers growing? Because we have poor lifestyle. And unless we begin to correct our lifestyles, invest in our lifestyles or change our lifestyles, whether we have cancer or whether we don't have cancer, that is going to be the common denominator that brings about some change in the numbers. Because as long as we go on believing that can be done beyond medicine, well, that's your fate. There's a lot that can be done beyond medicine. We're not saying alternatively to medicine, beyond medicine. You're in a toxic relationship. The best foods in the world are not going to make you healthy. The amount of exercise that you do is not going to make you healthy. The amount of chemo cycles that you take is not going to take away your cancer. You need to change and get out or change that toxic relationship or work on it. Because everything is environment, and that's why it's called epigenetics. Epi is environment that controls the expression of your genes. So many people have a healthy life and all of a sudden they get a genetic cancer. Something turned on that gene. Something made that gene express itself. What turned it on? Look at lifestyle. Look at the environment, external and internal. So no one is here to take away from doctors and medicine and all of that stuff. We're here to put it together. Because as long as this war exists between who's right, who's wrong, what's happening, use your common sense. Let's go back. When did cancer start happening in our world? When lifestyle started getting more erratic. When people started sleeping less, pumping themselves with more alcohol and drugs, emotionally destroyed relationships, empty lifestyles, unhappiness, and all of these things, poor foods. We think we have better foods. We're living in a world today where everything is almost genetically modified, hybrid, and all of that stuff. We don't have real foods like our ancestors had. So when you sit back and do the math, and you put your ego at the side and your pride at the side and stop hiding so much behind called evidence-based research, which has absolutely failed with the amount of statistics in cancer that we have. Use it. Use science, but use common sense as well. Use wisdom. If you're unhappy, you have a sick body. You are inviting sickness into your body because when you're unhappy, your immune system is low. When you're happy, you'll find when you're very, very happy, you rarely fall sick. A lot of people pretend that being happy. They carry these facades throughout the day to show the world they're happy and cover-ups with you're fooling yourself. There's a lot of self-work that all of us have to do, a lot of reconnection that we have to do with ourselves in order to enable that environment that I spoke about to support, recovery or prevent the onsets of cancers. So these are some of the commonalities that we've seen in thousands of patients over the years. Let me repeat that again. Just because you have acidity doesn't mean you're going to get cancer, but you see the bigger picture of its connection if it is chronic. The same thing with constipation and everything else. So don't use this as something to induce fear into you. Use this as something to inspire you and motivate you to change your lifestyle, because it is not okay for you to be constipated. It is not okay for you to be acidic. It is not okay for you to be lazy and sedentary. It is not okay for you to compromise your sleep for your life. And it is not okay for emotions to rob you of your immune system and your life. These are unnatural things to the body, and the body responds with sickness and with disease. So you put these things together and we have a lot more hope. Yes, there will be people who will die today of cancer, or an unlucky person, like I always give an example of a patient 5 years ago, got out of hospital in remission, cancer-free, stepped out of the hospital, got hit by a bus, died on the spot. That's destiny. There are things like that happen. You don't have to die just from cancer. You can die from anything. But what is it that we can do right now? What is in our control what we can do right now to prevent, rather than sign up that, oh, I'm going to get cancer, I'm going to die from cancer, it's in my family, I'm going to get it and stuff like that. That's you giving up, inviting it into your system. There is always something that you can do, and it is called looking at your lifestyle and making little inexpensive changes every day that can put you in a better position to handle any disease that may strike you down or to even prevent that disease. Have a great day, everyone. Until next time, eat smart, move more, sleep right, and breathe deep.